number a very strong number, and I thank each and every one of those Victorians who waited in a queue, got tested and got their results in the last 24 hours. That's how we protect you and your family, and indeed every family. So we want to keep those numbers as high as we can. Any symptoms whatsoever, please come forward and get tested. We'll get your result back to you as fast as possible, and you will have played your part in running this outbreak to ground and us getting back to normal. Now, in terms of where we find ourselves vis-a-vis Tuesday evening, Tuesday midnight, it is too early for us to determine whether we'll be able to come out of this lockdown at midnight on Tuesday night. It is, I'm afraid, not the day for us to be announcing parts of regional Victoria being let out of this lockdown, if you like, or operating under different rules. And whilst we take no joy from the fact that there is a case in Mildura today, and that'll require a lot of work from our public health team, there is a case in as far away as Mildura, and Jerome can speak to that in a moment. That just confirms, I think, for all of us, if we needed any, that this moves quick, and a problem anywhere becomes a problem everywhere, unless you've got rules on that are hard and fast, and you have taken this as seriously as possible from the earliest moment. That is the approach that we have taken, and it is working. I just can't yet make announcements for what will be relevant and what will be able to be done safely, what will be possible, if you like, for midnight on Tuesday. The next 24 hours, obviously the next 48 hours, are critical in terms of that. As soon as we can, to make those announcements today. Can I just, before I ask Jerome to speak to these cases and outbreaks, and then Brett will offer any commentary that you need, or we might just go to questions at that point, I think. Can I just thank every one of the many thousands of Victorians who are in ISO because of where they've been and who they've been with, many of which, the vast majority of whom will test negative and will be able to be released from that ISO. But you're playing a really important part in keeping the rest of us safe and making sure that this strategy works. We'll provide you with all the support you need, and we are deeply grateful, all of us as Victorians, and indeed beyond our state, because the sacrifices you're making, the contribution you're making, is about avoiding lockdowns in every part of our country. So we do thank you. It is many thousands of people, and they are doing the best of work, and we're providing them with the best of support to get that job done. That, of course, includes some apartment blocks that are completely locked down. That's very challenging, but we're doing everything from assisting with dog walking to food and grocery shopping, getting medical supplies, all those things, and to CQV staff, public health staff, some of our partners in local government, everybody who's working with us, including those who are the subject of these orders. Thank you very much. It's only through that team effort that we're able to see, yes, more cases, but more cases that are linked, a very big test number, and outbreaks that are unfolding as we had hoped. Not that we ever want more cases, but we're not seeing new fronts open up. We're not seeing fresh chains of transmission become evident to us, and that test number is very high and important to keep it high. Before I throw to Jerome, my final message, apart from saying thank you to everybody who's doing such an amazing job, following the rules, playing their part, any symptoms whatsoever, please go and get tested today. Don't wait till tomorrow. Don't put it off till Tuesday. Get tested today. We have opened extra test sites. We have longer operating hours for some of those test sites. We're getting results back to people well above 90% within 24 hours. We'll do everything we can to get you a result as fast as possible, but you've got to go and get tested if you've got any symptoms whatsoever, and please do it today. Don't delay, because in the time you delay, you can be in the company of others. They in turn can be in the company of others, and we just can't put all the pieces of the puzzle together as fast as we'd like. So please get tested, and get tested as fast as possible. I might now ask Jerome to speak to some of the details around those 16 cases, and then the three of us are happy to take any and all questions you have.
Good morning, and thank you, Premier. 16 new cases today. That takes the total for the outbreak now to 59 cases here in Victoria. 14,000 primary close contacts, 217 exposure sites. It's an increase of 50 on yesterday. And as the Premier said, over 53,000 test results received. It's 100,000 test results over the last 2 days. And my thanks to all those Victorians who came out and got tested in the last few days. And of course, the testing crews that are making all that possible. I'll run through briefly the new cases and just an update on the exposure sites of real concern. We have 5 new cases today linked to the Miss Frankie's restaurant in Cremorne. That's the first 5. 1 staff member and 4 patrons, making it a total of 8 people associated with that restaurant who are now COVID positive. We have 4 new household contacts in the City of Hume exposure, again part of an extended family connection, so we now have a total of 10 cases in the City of Hume cluster, but those 4 new cases take us to 9 for today. We have 3 new cases associated with Trinity Grammar, 1 a student, 1 a staff member and 1 household contact. That takes us to 12 for today. We have 2 contacts from Amy Park, from the Wallabies versus France game at Amy Park. Both were in the area of the stands of concern, sections 20 to 23, coming in through gate 7. We have sent a lot of messaging to people who were at the Wallabies game on the Tuesday night. I'd really urge everybody, please check and confirm where you were in that stand. If you came in through gate 7, if you're in sections 20 to 23, you must come and get tested and isolate. That takes us to 14 cases for today. We have an existing primary close contact of the group of friends who went to Phillip Island. That takes us to 15. And then finally, a teacher from the Bacchus Marsh Grammar, which takes us to 16 new cases for today. All existing exposure sites and areas of known concern. In addition, this morning, literally in the last hour, we have another positive case confirmed in Mildura. My understanding at this point in time, it's a man in his 30s who was at the MCG for the Carlton-Geelong game last Saturday or Saturday before last. We're obviously working with him and his extended close contacts. My understanding at this point is he was in the level 2 of the MCC reserve and will, of course, continue to share any other information we have during the course of today. Currently, there are 4 public exposure sites where we've seen significant community transmission in this outbreak to date. That includes the MCG, now with 6 cases, including our Mildura case. We have over 2,000 primary close contacts, and we're making good progress on getting negative test results, with around half of those returning negative test results. The numbers do keep shifting around. At Amy Park, and Amy Park is a significant area of focus for us today, we have now 3 confirmed cases, as well as the index case, over 1,700 identified primary close contacts. We really need you, if you haven't been tested yet, to come forward and get tested. We're very keen to close down what exposure we've seen at Amy Park. Frankie's restaurant I've referred to, we've seen 8 cases there. There was a large dining group that was there with also some exposure to staff members. We have 212 primary close contacts and seeing test results come in for them. And then, of course, Young and Jackson's. We haven't seen any recent cases turn positive there. 313 primary close contacts, so some more have come through in the last 24 hours. Around 60% of those have returned a negative test result. The other exposure sites where we've seen other forms of transmission, but they're generally speaking more closed sites, the Ariel apartments, we've seen no new cases recently, and over 3/4 of those primary close contacts have returned to negative results. Bacchus Marsh Grammar, we've seen some exposures in the staff body. Most of the staff have now returned negative test results. We are extending our testing to all the students, but half the students have been tested so far and returned a negative result. I expect the remainder of those to come in over the next day or so. Trinity Grammar has got 3 positive cases in total so far. Again, we're extending testing to the student cohort, 2,200 primary close contacts. Around 40% of the students have returned a negative test result. Again, I expect the remainder over the course of today and tomorrow. And then finally, obviously our City of Hume cluster, over 70% negative test results on those. And Barwon Heads Primary continues to run smoothly. No positive cases there. Over 80% of those results have come back negative. And finally, the naval base at Cerberus, all those results have come back as negative. Obviously, we continue to isolate a number of people, but please, we've seen no evidence of onward transmission at this stage. As the Premier said, we continue to expand and extend our testing operations. A big day yesterday and the day before. The showground site at Ascot Vale opened this morning at 6 o'clock and will run through to 10 o'clock. And most of the sites yesterday were running pretty busy until the middle of the afternoon, much quieter in the end of the afternoon and early evening. So I would please, with many of our sites open to 7 p.m. and 8 p.m. and 10 p.m. in the case of the showgrounds, please check later during the day. We do have live updates on our website about how the queues are running at the various testing sites. Also a big shout out to the Basque Coast Health team. I know they were very busy yesterday at Wonthaggi, at Leongatha, at San Remo and at Cowes. We have expanded further, or they've expanded further, testing at Cowes, especially today, and my thanks to them for the sterling efforts of that team across a big piece of our state. We've stepped up testing for the freight industry, so the rail freight workers and port workers can get tested from today at Port of Melbourne, and the truck stop testing at Broadford also opens up later on today, and we intend to open up another truck testing station tomorrow morning, which we'll talk to the industry about. We continue, of course, to monitor risks inbound from Interstate. 1,900 arrivals checked at Melbourne Airport yesterday. Really high levels of compliance, well above 90%. And my thanks again to the officers working at the airport and their ongoing diligence on that front. We also made 380 household visits yesterday. Well over 95% of people were complying with the testing requirement if they were red zone arrivals. In fact, 99%, I'm sorry, had already completed their testing requirements, and no referrals made to Victoria Police. And again, my thanks to all those over 10,000 red zone returnees for complying with those testing protocols and those isolation protocols. We can see how important that is. And of course, with the 14,000 primary close contacts, their isolation protocols are critically important at this time. Finally, on vaccination, 16,751 vaccines delivered yesterday here in Victoria. Again, we're seeing some really strong uptakes of our vaccination options, and please, I'd encourage all people, if you're eligible for Pfizer, please come and chase after those remaining Pfizer slots we have available over the next few weeks, both first dose and second dose. We also have an additional set of Pfizer appointments being made available to those priority workers, and those appointments are being pursued well. Finally, my thanks to everybody who is part of this huge effort. We now have testing teams working literally across our entire state, pathology teams working day and night, and of course our clinicians across all of our hospitals working in Tier 3 PPE, taking those extra steps to make sure we're ready to manage this outbreak. With that, I'll hand over to Brett and we'll take any questions.
Thanks, Jerome. Good morning. So just to a couple of sporting events. So if you're a rugby fan, please, I want you to pay attention. If you're a soccer fan, or enough of a soccer fan that you consider yourself a football fan, then please pay attention. The Wallabies versus France match at Amy Park Stadium, as you've heard from Jerome, now a transmission site. And then there's the Euro finals, the soccer or football match at the Crafty Squire in the CBD. Not yet a transmission site, but one that the public health team that I consider a potentially very high-risky site. Firstly, my advice to those who've attended at Amy Park for the Wallabies versus France match: if you entered through Gate 7 between 7:56 and 8:13 p.m, you must immediately isolate, get tested and quarantine. So that information will be up on the exposure site list online, but 7:56 to 8:13 p.m. If you sat in aisles 20 to 23, get tested and isolate until you receive a negative result, unless you've received contact from the department that you might be a closer contact by virtue of where you've sat. If you sat or entered elsewhere and you have any symptoms at all, please get tested. We are going through CCTV footage now that's being reviewed, so I'm also flagging that Public Health will meet, review and discuss whether the contact definitions need to change for this group in aisles 20 to 23 or anywhere else, and stay alert for updates in terms of that messaging. For those who've attended at the Crafty Squire, if you were there for any period of time from 3 o'clock in the morning to 8 a.m. For the finals match, then you have to get tested and quarantined for 14 days. Call the department on 1300 651 160. These steps will protect you, they'll protect your loved ones and the whole community, and may be really critical in helping us get ahead of this as soon as possible. All exposure sites are high risk by their very nature, especially those that we flag as Tier 1. We are concerned about the Craft Squire event. There will have been people there for a prolonged period of time. If they were eating and drinking, then masks will have been off. I'm sure there will have been shouting or, for the English, crying. So risk of transmission by virtue of that. There were more than 400 people present. We are going through the ticket holders. We're going through the QR codes. But there were a number of people who bought tickets in bulk and gave them to their friends. So it's really a shout out to anyone who's been there from 3 a.m. to 8 a.m. To contact us and to make sure you're testing and quarantining. We have made good progress with the outbound calls, but there are still others to reach. As Jerome said, there are 215 other public exposure sites, a number of private sites such as schools that have been impacted. I need everyone to check those sites online every day. They do change continuously. This Delta outbreak is telling us that there are settings with transmission that we really haven't seen before, and that transmission is happening in more and more of those places and to more and more people. I said yesterday the next 24, 48 hours are critical. That remains the case. Please check in with QR codes everywhere, every time. Get tested with any symptoms whatsoever. If you're eligible, please get vaccinated, and please check those exposure sites on a daily basis. Thank you.
I'm happy to take any questions you have.
Can we have some clarity around the situation with the apartment blocks as to which are in lockdown and which aren't? We've had a lot of confusion from residents there. Some saying there's someone in there with a positive case, but they don't actually know whether they're...
Sure. So let me run through 2 apartment blocks we're working with actively at the moment, and a third that we're just looking at supporting. The first, of course, is the Ariel apartment block that we identified on Monday of last week. All those residents, 131 residents, continue to isolate and are well, and there's a team on site supporting them to continue to do that, and we'll be testing them again today, sort of halfway through their exposure period. Secondly, we have the Isola apartment block in Richmond that many of us went to yesterday afternoon. All those residents are being tested today. I can confirm we have a positive case who lives at that apartment building. They moved out yesterday, so they are in hotel quarantine. So there are no known positive cases in that building. We have no evidence or reason to believe there's been any transmission on site. It's important to remember that's quite different to Ariel, where we had the removalists working for 4 or 5 hours. So we have no evidence of transmission within Isola, but out of an abundance of caution, we have put support on site. We will be testing all the residents within an on-site in-reach testing program today. We'll obviously review the results of that, and then we'll make the appropriate public health judgment about what to do going on. There is a further location again in Fitzroy where a positive case lives in an apartment building. There's a team working on that location today with the residents concerned. Again, I stress at this point, having a positive case living in a building does not mean the entire building has been exposed. We will take a location-by-location approach to assess the level of risk, both the individual and to anybody else around there. Where we need to put additional measures in place, we will absolutely do that, as we've done repeatedly over the last few weeks.
So specifically, which ones are in? Can you just, so that people understand, which is in lockdown, which isn't?
Right, so be very clear. So the Ariel apartment building continues to be in lockdown, so all those residents have been instructed to isolate, and they continue to isolate for their 14-day period. At this point in time, the Isola apartment building on Burnley Street is in lockdown, so we've asked those residents, told those residents to isolate for 14 days. We will undertake testing today, and then we'll review the progress of that particular building. I can't make more comments on it at that point. The Fitzroy building we are assessing at this point in time. We'll work with those residents, and if we've got more information to update, we will.
Within this outbreak, there seems to be 5 cases. Were they all from the same night, given there's concern that a staff member may have had it? Or
Is this from Ms Frankie's?
Yes.
Yeah, so the Ms Frankie exposure was on the Tuesday night. It was before there was a large dining party that went there before they went to the Amy Park game. We have so all the exposures we have is on that Tuesday night. Those deals have been on our website for a number of days now. At this point in time, we've identified 6 other patrons who are positive, some in that dining group, possibly some others outside of that dining group, and 2 staff members at this time.
And just going back to on the apartments again, Appleton Street, Richmond.
Yeah.
What's the deal with them? Are they in lockdown too, or...?
Not at this point. So again, remember, we deal we deal with primary close contacts on the basis of what level of exposure they may have had. So, we don't do drive-by primary close contact definitions where we say everybody who's ever been there is a primary close contact. That work is done carefully. As we've seen at some of these large exposure sites that we've been dealing with, the public exposure sites, as Brett has said, sometimes we start large and then we'll contract in if we can. As we've seen with the MCG, when additional information becomes available, sometimes we have to broaden the net as well. So with those individual apartment buildings, we're going through them very carefully, as we've done with Isola, as we're doing with a location in Fitzroy at the moment, as we've done with Ariel and all the previous ones. We'll work collectively across all those resident groups, assess it, and we'll always take a cautious first approach. At the back, we'll come back to you.
Can you tell us a bit more about him? Do you know if he went straight back to Mildura or to other towns, and will there be exposure sites in that part of the world shortly?
Yep. So all I know about the Mildura case this morning is that his positive result came through in the early hours of this morning. The local, he's currently he presented to the emergency room at Mildura Hospital. He's currently in the care of those clinicians. We've also put protocols in place at the hospital to ensure the safeguarding of other staff and people in that hospital. We are continuing to interview him this morning. We'll work out exactly what his movements have been. My understanding at this point is that he was part of a group of 3 household members who travelled to the game. I don't have his travel details about when he travelled up, when he travelled back and how he travelled. My understanding, again, and this may evolve as we do more interviewing, is that he was on the MCC reserve on level 2. That would make him at least a tier 2 contact, possibly a tier 1 contact. That information will come out and we'll obviously update during the course of the day if we need to.
Whereabouts was he sitting exactly?
Sorry?
Was he at the emergency room because of his COVID symptoms?
He presented late last night to the emergency room. I'm not sure why.
Where exactly was he sitting in that members' reserve?
I don't have that information at the moment. My understanding at the moment is that he was in the members' reserve area generally, but I don't have his details of his movements yet. You'll appreciate we're interviewing him now. We've known about this information for about an hour and a half, so a lot of activity underway today.
Do you know if he knows anyone there, or would that be a stranger case?
So again, we don't have that information yet. Interviews are underway. We'll obviously do what we've always done. We'll review the movements. We'll review the CCTV. We'll look at the QR code information. So I'm confident that he was on our initial list, at least of tier 2 contacts, if not tier 1 contacts, and he would have received messages through that process.
Are you expecting his family members to
Is he still in hospital because he's unwell, or because that's where he was found?
I don't have that information at the moment. Clearly, he presented to the emergency room last night. I'm not sure with what symptoms. It wouldn't be appropriate for me to speculate. He's in that place at the moment. Obviously, we want to make sure, as a COVID-positive case, a series of protocols go in place, as we do with all of our hospital departments, to make sure both for his safety and also for the risk of contagion to everybody else. So he is safe. He's well secured, and we'll work with him over the coming hours.
his family members to test positive as well?
Well, of course, he will be on the basis of that household group. If indeed they're tier 2 or tier 1 exposure sites, they will, of course, also be under their own isolation testing protocols. We'll work with them today, and as we do with any positive case, we'll extend those contact tracing rings around him very swiftly.
The Premier's outlined that he's not quite comfortable to release any regional areas from lockdown. Is that because of this Mildura case? Can we expect any other areas to be released?
Not a matter for me. I'm chasing down these cases at this point in time. Either the Premier or the Chief Health Officer will comment.
Julia, I wouldn't read into it. It's not that we know about a case somewhere else in regional Victoria. The point I'm making is that there is one in Mildura, and that's about as far away from Melbourne as you're going to get, and still be within our state. So it just goes to make the point. I'm not pleased to make it, but it just goes to confirm the point that a problem anywhere is potentially a problem everywhere. And that's the reality we're living. Problems out of Sydney have become challenges here, and if there's a problem in Melbourne, then there's every reason to believe that we have to have a very conservative approach to parts of regional Victoria. And I know it is incredibly frustrating for people who are a long way from Melbourne, but this virus can reach you, as we see with this Mildura case. I will be across that as quickly as we possibly can, locking people down, providing them with support, all of those things, and we'll report progress on that. As I've said a number of times, if I get advice, I do not have any advice. If I was to get advice that parts of regional Victoria could be allowed out, then we wouldn't hesitate to do that. I have no such advice because it is not deemed safe to do so at this stage, and I think the Mildura case just demonstrates the state, from a virus point of view, the state's a lot smaller than it might seem.
Are you reluctant to release regional areas ahead of that deadline of midnight Tuesday?
I will not release any area of the state unless I get advice to say it's safe to do so. I have no such advice.
Given it's Sunday,
yes.
Is it highly likely that regional Victoria is going to be in lockdown until at least midnight Tuesday?
Oh, look, people can draw their own conclusions. The settings are midnight Tuesday, and until I announce different settings, which will be the result of advice I've received. I have no such advice. If I get any advice to that end, then I'll be standing here and answering all your questions on it. I wouldn't read any more or less into the... Everyone is in until midnight Tuesday, unless we announce a change. I have no advice to announce a change, and the Mildura case today, I think, just confirms that Victoria is a big state, but when it comes to the spread of this virus, it's actually quite small, and it can move to the furthest point of our state very, very fast.
But Premier, what are you comfortable with? You said when you announced the initial lockdown that you would be releasing some regional areas from lockdown. That now doesn't seem the case. What are you comfortable with?
Just be clear. I didn't say I would be. I said I would if I got advice that it was safe. I don't have that advice. It's no more or no less than that. I will not do something without advice to back it up. And I think at the moment the advice. I have no advice to shorten the lockdown in regional communities, which I read to mean it would simply not be safe to do that. That may change over the next 24 hours. Let's wait and see. But as I said on Thursday evening, you only get one chance to go hard and fast, to act early, to act decisively. That's what we've done. Our hope has always been midnight Tuesday. We are seeing these outbreaks unfold as we would want them to, so it's relatively linear, if you like, so everyone's a link in a chain that was known to us previously. This Mildura case is obviously out of left field a bit. Let's just wait and see how things unfold over the next 2 days. This lockdown won't be on any longer than it needs to be, and I can tell you it'll be much shorter than it would have been. Look at these cases that have just unfolded in the last couple of days. If we'd been open, then we wouldn't be talking about 40, 50, 60 cases. We'd be talking about an altogether bigger number and an altogether longer lockdown. So this strategy is working, and it's only working because our health team are doing an amazing job, but everyone at home is doing an amazing job. I know this is not fun. This is no one wanted to be where we are, but we'll be out of this much faster if everyone keeps on playing their part.
We're just 2 days out of that deadline. Has your health team given you any indication of whether they think it will be safe to release regional areas?
No. I can't be clearer. I have no advice to do that. And therefore we won't be. If I were to get advice, then of course we would be here talking to you about it, and we would share that with regional communities as quickly as we possibly can. And I think we've got a record of trying to give people as much notice as possible. The next 24 hours, the next 48 hours are obviously critical, not just in the centre of Melbourne, but right across our state. And I would have thought that a case in Mildura, a long way away from Melbourne, just makes the point that our state, we are a big state, but when it comes to the spread of this virus, it's actually a very small task, a very easy thing for this virus to get from one end of Victoria to the other. It's got from Sydney to Melbourne pretty quickly, so, you know.
He is definitely a Mildura local and not someone from Melbourne who's gone up there to a holiday house.
I understand he's a local.
Yep.
Mildura is a very proud community, but it's a relatively small community, so you'll, I'm sure, accept and understand that we won't necessarily be providing all sorts of detail that might identify that person. That person's entitled to be treated privately and with some privacy, I should say, and that's what we'll try and do. But we're working with that person. I dare say in the public health update later today, we might be able to give you some further details about circumstances, his close contacts, things of that nature. But we're literally, as I understand it, we're literally interviewing that person now. So if we could tell you more, we would.
Why has Victoria knocked back the request from New South Wales to help with contact tracing? And will you consider changing that if we get on top of our contact tracing?
Always. We are all about providing help when we can. I've sent text messages to Gladys. I've spoken at National Cabinet on numerous occasions offering help, and we're always ready to do that. But just as I think you'll find last year, New South Wales were of assistance to us until they started to have their own cases, and then they focused on their own job. And that's not just for them, that's for the whole nation. Us dealing, the greatest contribution we can make is not providing some assistance to New South Wales. The greatest contribution that we can make is to get this under control here in our state. And that's exactly what we'll do. If we get to that point and we have excess, we can help others, then we have before and we would again. But it's nothing more than we help others when we can. At the moment, we can't. Hopefully, in the future, we will be able to. But hopefully, there's no work to do. Hopefully, it's under control everywhere. We'll just have to wait and see how things go. But I wouldn't read any more or less into it than that.
Is there any scope for a backup vaccine system? With a story in the papers this morning about 100 people in a day not turning up for their shot. Can we design some sort of a system where people get notified where they're not turning up so they can then go and get the jab?
Well, look, I'll just make the point, we don't draw the vial until the person's there. So the notion that because someone didn't turn up, but I'm not encouraging people not turning up, but the notion that because a person didn't turn up, that vaccine is wasted is simply wrong.
But in terms of getting it speeded up?
Well, yeah, of course. We're always looking at different ways of doing things. It's obviously different with different products. So when you come to AstraZeneca, just sort of dragging people off the streets a little bit challenging. They need to have had a conversation with their GP. They need to be clear that it's safe for them. But look, we're always looking to try and refine things, and we've made lots of changes over the journey. That's why Victorian state-run clinics have done more jabs than any other state-run clinics anywhere in the country, and we aim to keep playing our part. So we'll always look at ways in which we can improve. But I just don't want anyone thinking that there's a whole lot of syringes waiting, and if the people don't come, the whole thing goes in the bin. That is not the way that it works.
Premier, how much will the situation in New South Wales impact on your decision around whether to extend or whether to lift lockdown? We could get on top of this outbreak here, but if they're not on top of it, there's always that risk that it comes over the border again. Is that going to make you hesitant to lift lockdown? Yeah,
look, I don't want to be drawn into a kind of implied criticism of New South Wales, but I'm not assuming, I don't think anybody in New South Wales is assuming that what they're going through is going to be over or really in any way changed by midnight Tuesday. They're in it for the long haul, I would have thought. What we hope to be able to achieve is to deal with these couple of outbreaks with the cooperation of the Victorian community. Painful, challenging, but 5 days, or a shorter lockdown is much better than a longer one. Put it to another way, what's going on in New South Wales is not going to be over by midnight Tuesday. That's going to be something that we have to live with, something that we have to guard against for quite some period of time. That's why we wish them success. We wish them nothing but success. And if to Anna's point earlier, if we can provide help down the track, then of course we would. Because the sooner they get their wave, their outbreak under fundamental control, the less likely it is that cases come here. So I don't think that our current measures are not based on New South Wales, other than, of course, they're based on cases that have come from New South Wales. But once we get this under control, we're going to go back to doing what we were doing, defending against more cases coming here.
Can we ask you about the football?
Younger people, or where younger people might want to go there.
Yes.
Cocktail bars or sporting events or things like this, a lot of them have been in their 30s.
Yes.
So is that something we should reconsider when we're looking at the vaccine, and what would your message be to under 40s that maybe are hesitant to get the vaccine? Is there still a message of get it if it's safe to do so?
Or
should we consider changing our policy on this, given the...
Well, I would just make the point, between Pfizer and AstraZeneca, and then of course Moderna coming later in the year, the vaccine is safe. The vaccine is safe. If it relates to AstraZeneca and certain age groups, then you should have a conversation with your GP. Not with your Prime Minister or Premier, have a conversation with your GP, and your GP will speak to you about what's safe for you. Look, there's a lot written about how there's large groups within the community that are hesitant to get the jab. That's not the experience that I'm seeing. I think there are many, many more people who want the vaccine now than we have vials to give them. That's not something that I can answer for. That's a Commonwealth issue. The only limiting factor here is not the number of people who want the jab, not the number of staff to do it. It is the number of vials, the number of boxes of this stuff, crates of this stuff that we've got. And the sooner we get more of that supply, the more people will be able to get vaccinated. The good news is that General Fruin, as recently as Friday at National Cabinet, assures us again that those different horizons, to use that the ADF term, in September, October and November, they're on track to meet them. So we're going to see more and more product here, which will mean more and more people can get the jab faster.
Any idea what's going on?
Number of schools that have become affected?
Pardon?
Are you concerned about the rising number in schools affected?
Well, we're seeing this Delta variant transmitted amongst younger people, amongst school kids, all sorts of challenges, right? This is a different thing than what we faced last year. I think it was the right call to follow advice and to close schools. We will hopefully have those open very soon. But there's kind of two ways you can do it. You can close all of them, or you can have them just close one by one, have the community's confidence undermined, have a real sense of concern, but teachers and staff and parents, should we be going to school? We thought the better thing to do, because it was for a short period of time, to make that call. I'm not for a moment saying it's easy for homeschooling for parents. It's not easy for teachers and staff either, but I think we've made the right judgment. That'll be one of the many things that we look at as we approach midnight Tuesday.
Just on schools, it seems that should or will teachers get put into that high priority level for vaccines so this doesn't happen again?
Yeah, look, I can't comment on who will and won't enter different cohorts and get different priority beyond what's already been signed off. Again, there's not the limiting factor with teachers getting vaccinated or anybody else is not an unwillingness to protect people, or an unwillingness, can I say, on the part of teachers or staff or any frontline worker or anybody to come forward. I think there's many more people who want to get vaccinated than we can vaccinate, and the only limiting factor on that is the amount of vaccine we have here. Nothing more, nothing less than that. Like, we've done well over a million in terms of just out of our state-run clinics. GPs, now very soon, community pharmacy, not just in the regions but hopefully across the board, will be doing more. It's all about how much supply you've got. I think there's enough demand there. I think the sense I get is that many people want to get the vaccine because they know it's safe and they know it's there. It's them playing their part in us getting back to normal. Well, Victoria won't be prioritising one group over another in a one-off. We need a national framework, and we already have one of those, and that'll evolve and change over time as it already has. I will, with the greatest respect, just make the point: you can prioritise journalists, cameramen, you can prioritise whoever you want. If you haven't got the gear, then it's a moot point. It's just words. What we need is the supply. That's supposedly coming in September, October, November, and then we'll be able to prioritise everybody, basically, and get as many people vaccinated as possible.
Premier, Trinity students are sort of bearing the burden at the moment, being told to isolate, and their families to isolate as well.
Yep.
But other schools like Bacchus Marsh, who've had outbreaks, are not having that instruction. Is the virus spread differently through Trinity? Why are they?
No, every case, every exposure site, every event on its merits, and I know that can be quite frustrating. And I've even had friends of ours who've been caught up in some of the activity that's occurred in that Oakley, Murrumbina area have rung me and Kath and said, oh, well, we got told one thing one day and something else the next. Because your circumstances change. You went from being Tier 2 to Tier 1, somebody tested negative, so you were let go, somebody later tested positive, so you were drawn into the loop. What's happened at Bacchus Marsh with essentially a teacher event, a conference of 350 teachers, is very different to what occurred at Trinity or at any other school. So what we try and do is be as focused on the facts as possible in each individual circumstance. So that does mean seemingly similar people, so I'm the same status as the person next, well, actually no, you may not be. And that's why you get personalised information, and the information can change. And sometimes that's good news to say, right, the person who we thought you had spent time with who was a worry to us, they've tested negative, you're now free to go. Other times it's the other way around, and people can be drawn closer into an outbreak rather than further away. We try and provide that information as quickly as we can, but it does change, and I just send a message to people. It's well over 10,000 people who are locked away doing the right thing for the rest of us. We're very grateful to you, but please do appreciate that what you need to do and advice to you may change based on your circumstances and the circumstances of others that you have been in the company of, or places that you've been to.
There's a far-right
We're going to go, yes.
The government having discussions with the AFL about how the remainder of this season can progress, and I'll just be cheeky and squash a couple of questions together.
No problem.
Will we see crowds again, do you think, during this season, and are we in danger of again losing the grand final?
It's my hope that we have crowds back at the footy as soon as it's safe to do so. And it's my hope that the grand final, together with a vast array of other major events, will be conducted in the major events capital of our nation, the great state of Victoria. That is my aim. That's what we're working towards. That's why paying for a short time now is far better. So 5 days is better than 5 weeks, or days are better than weeks locked down. We don't want this to run. And what we've seen over these last 2 or 3 days, just in the number of extra cases, one of the reasons why I think we can have some confidence that it's tracking as we had hoped in that kind of linear fashion is because we're limiting movement. Driving on the Monash today to come to speak with you guys, very, very little traffic. That's exactly what we want to see. Limiting movement limits the spread of this virus.
There's a far-right.
And in terms of AFL, yes, we'll be talking with them. We'll be talking with all the codes. about what the second half of the year looks like, what the year looks like in the context of the Sydney challenges, and we hope to get back to something approaching normal as fast as we possibly can.
There's a far-right British figure who's come in and she's in hotel quarantine and
in Sydney, I understand.
A mockery of it. We've also seen members of the Jenner Kardashian family come in. There's still 30,000 Australians that can't get home. What do you think about these people being allowed in for what is reality TV shows when Australians can't get back?
Well, I don't issue visas.
What do you think of it?
And some of these people just want us to talk about them. And that's why they perhaps take some of these outrageous positions. So I'm not going to feed that. I'm just not. If you want to know who gets in and why and how, then you need to speak to the Immigration Minister, whomever that is these days.
The government exposure site is down right now. Do you know about that and why?
No, I don't. Probably being updated. Probably getting a whole lot of new information put on it, I would think. I don't know. If it's happened while we're here, we can chase it up for you.
Now,
we can chase it up for you. You can chase it up. I'm not monitoring the website as I speak to you.
Frankie, businesses clearly need time to prepare if there is going to be a lockdown extension.
Yes.
What is the latest time that we can expect an announcement from you?
Look, we've always, and this has not always been popular, we've always waited to have the most complete picture. So I can't give you a time, but I think tomorrow we'll be able to share a bit more with people. But we will wait and try and strike that very difficult balance between giving people some notice but having the most complete picture from an epidemiological point of view. So the time is your friend in some respects. The more time you have, the more data you have, the better understanding you have about the spread of the virus and the greater assessment you can make in relation to risk.
So we can expect an announcement tomorrow?
I'll be out tomorrow and hopefully I've got some announcements to make. If I do, I do. If I don't, then it'll be the following day. We're just going to understand, and I hope people understand across the state, that we will give people as much notice as possible, but we'll follow advice, we'll do what's safe, but we will wait to see as much data, as much information as possible, and we will try and give people as much notice as possible, but that's very, very challenging. And getting this right is, can I say with respect, more important than giving people notice. It's dynamic. It's, in fact, faster moving than it's ever been, and that makes, giving people a really orderly picture of things quite hard.
And just for clarity on that removalist ban,
Yes.
what happens if removalists were booked before the ban was introduced? And are you granting any exemptions in regards to that ruling?
When you're booked, it won't matter. You'll need a permit. You need a current permit. As far as exemptions go, as I understand it, we have a process to work through any individual circumstances, and I don't think we have granted any exemptions yet, but we certainly have a process to look through. And if there was, to look through those individual circumstances, if there was extreme hardship, then we would look at that. We're not unreasonable, but it's also, I don't think it's unreasonable to say this is, by virtue of the nature of the work and past experience, this is a higher risk activity, and we just need to do everything we can to try and de-risk it, which is what we are doing now. And I want to thank the freight industry, who really have stepped up. There's extra testing sites, roadside testing, extra testing that's going on, and I'm just delighted that the freight industry, through the Transport Association and others, have stood up and agreed to do that extra testing. It's in the national interest.
Last night, the Amy Park, a lot of sites there were upgraded, Gate 7 for instance. But the AFL seemed to have advance warning of this. Earlier in the day, they announced that a number of their players had been to these sites and had to be tested and returned a negative test. Is the AFL getting a heads up before the general public about these exposure sites?
I see a bit of reporting about this. It's simply wrong. It's simply wrong. It's not like coronavirus landed yesterday and this is all new. Like the notion that a big professional sporting organisation like the AFL, who are national and who've dealt for like 18 months with border closures and outbreaks in different parts of the country, it is not beyond a group like that and many others to make decisions in anticipation of things that may or may not happen. For instance, we had people fly from Adelaide recently on a punt and then were flown back without playing a game. So just because people happen to sometimes get it right or not doesn't mean that they had an inside running. We stand here and we are very keen to make sure that everybody knows as much as we can possibly share with them as quickly as we possibly can. So I know there's been a bit written about that, and there might be some views. I'm just saying that from my point of view, that's just simply wrong. But it's not like they're dealing with this stuff for the first time. They've been dealing with it for 18 plus months, and sometimes they'll make a call. Sometimes they'll probably, maybe, dare I say it, be able to read the play. That's just the nature of these things.
It's been an intense few weeks back at work for you. How's your health and your back holding up?
Yeah, good. My back is fully healed. My ribs are not. So it's a joy to stand here before you for lengthy periods of time. It's good. It's good. It's doing my posture the world of good.
Dare I say COVID's not a pain in the back for you like it is me, Premier?
No, it's a pain for everybody. I think one way or the other. One way or the other. But, you know, you've got to do what you've got to do. We don't want to see thousands of cases. I don't want to be standing here reporting, you know, what others are having to report at the moment. I don't want that. We've been there and we don't want to go back to that. Now, I can't guarantee that. Just like I said, I can't guarantee midnight Tuesday. But what I can guarantee every Victorian is that we will follow the advice, we will do what needs to be done. And these cases started in Sydney, they will end here. Be in no doubt about that. And then we'll go back to defending the border, because what's happening up there will not be over before this outbreak's over. So it's an ongoing thing. It's that sort of vigilance that we're all going to need to show for many, many months, until, of course, we get those supplies of vaccine and we get that pent-up demand, all those many millions of Australians who want to get vaccinated, we get them through that vaccination program.
Premier, there's a number of exposure sites as well from Thursday evening. So
Yes.
I guess after you would have announced the lockdown, but the lockdown wasn't actually in place.
Yes, because the outbreak preceded the lockdown. So there's been exposure sites, well, for 18 months almost.
Yes, but
On and
so
off.
Thursday evening, though, I guess people,
Sure.
it's front of mind, were going into lockdown.
Yep.
So there were 2 bars in the city, but also a basketball game at MSAC on Thursday evening.
Yes, yes.
Do you think that an event like that should have been running, given that in a couple of hours the state was going into lockdown?
Well, I think you need to appreciate that we receive public health advice. So we receive. Many people think it's a menu. It's not so much. It'll be, here's what we think we should do. There's always a discussion about whether you could do more, but here are the things you should do. Here are the things the government should say yes to. From memory, that was at Cabinet Committee meetings sort of 3, 4, 5 o'clock in the evening, around that time. And then, of course, we get ready to come and explain it all to you guys, and it's not effective till midnight. So you could run the same argument. You know, there were a lot of people who spent a lot of time in pubs and bars late on Thursday night because they knew there'd be a lockdown and they wouldn't be able to do that. Look, it's a fine balance, and to the earlier question about will you give people notice, we always try and give people some notice. You could do a snap thing at 6 o'clock or whatever it might be. That does have a lot of inconvenience, but I don't think that would necessarily have addressed your issue.
I guess I'm not talking about a government intervention, but is it on people themselves to say, wait a minute, maybe I shouldn't go play this game of basketball?
Oh, look, I think that in general terms, I think people are very attuned to the rules. I think venues are very attuned to the rules. And I think everyone tries to work as hard as they can to make sure that every event, regardless of its setting, is as safe as it possibly can be. I wouldn't think MSAC was any different.
Can we ask Jerome? Sorry.
You most certainly can.
Jerome, on exposure sites, now that we have more than 200, are there some delays? We're hearing some concern, particularly from the Bacchus Marsh community, about they're aware that cases have been to places like gyms that aren't up there yet. Is there some delay in getting them on the website?
No, I don't. We're not seeing that. We're not hearing that. And of course, we always, and we have to prioritise what are the exposure sites we're really going to drive proactively, and what are the ones we're putting out for the community to be aware of. And I went through my list earlier on. You know, we have 8 public exposure sites where we've seen active transmission. We have teams actively driving those and making sure we pull all those personal close contacts out and get them tested and get them through. There are another, 200 odd exposure sites which we're also very keen to ensure that people check, register and do the right things on. We get a lot of information from the community, and we've talked about this many times before. We really appreciate people getting out there and saying, this is the information I've got, putting it out for their own social networks, communicating whichever way you want to. The more information that's out there, frankly, the better. I would ask people to check with our information before you make a decision, as the Premier said, about what you need to do. Check the website and check any information that's being sent to you directly, because that may be different to what others are getting. Anything else for me?
colleague, Professor Sutton's face was on mugs and bedding last year. Your face has turned up today on a cushion for sale. How does it feel being the pandemic poster boys?
Yeah, I apologise. I think my mother's been getting carried away, so she probably set that up, so nothing to do with me. What I will say, in all seriousness, last night I dropped in at one of our testing sites at Denley Park. About 6:30, it was cold, it was dark, it was wet, and you have a group of people who've been there towards the end of a 12-hour shift just doing the most amazing work, and that's the people who really make a difference. The people in the testing stations, the people in the pathology labs, the people in our health services, they're the ones making a difference, and they're the ones we should be talking about and praising.
Can I ask Jerome a question?
Sure.
The ABC has also been hearing concerns from the Bacchus Marsh community, and they themselves are listing, their own businesses online so the community can know. So are you falling behind to some extent, given the number of cases we're now seeing?
No, I really don't think so. Look, we're reporting significant numbers of not only cases, but certainly personal close contacts, 14,000 or so today. Yesterday we were over 10,000. So we are seeing significant, a number of additional Victorians being brought into the outbreak and being asked to isolate and do all the right things. Certainly with Bacchus Marsh Grammar, we've tested 361 staff. They've all been tested. We have 6 positive staff, 1 positive student. We're now working our way through the student body. There's 2,300, I think, students at that particular campus. We're about halfway through getting their testing results through. That's a big cohort, and we've had a lot of testing activity on site there. We've also working through their households. And look, and I get the fact that people are probably frustrated and saying, well, can you deal with me now? I want to make sure we've got full closure of that particular site, and then we'll assess what the next condition should be. But we're not falling behind. We've got a good grip on this. We've got a good grip on the many different strands of this outbreak, and as we've discussed earlier, it's a linear progression. We can see where it is, but we've got some quite far-flung places that we need to continue to get our arms around.
And with the Crafty Squire, can you say how many people checked in and also how many people you believe were there?
So at the moment, because it was a private event, ticketed event, there are 400 people we believe that were at the event at the Crafty Squire. Obviously, we're reviewing again with all those people coming forward, and particularly the individuals who bought the tickets and handed them out to their friends. And it's a particular reminder when we're dealing with events, transmission events at Amy Park, potentially, I say potentially at Crafty Squire, and certainly at MCG, if you're buying tickets on behalf of other people, the messages you get from us or from the AFL or from Amy also relate to your friends who are there. It's really important that your own social telegraph starts to work, because we don't know who you decided to bring along with you. It's a critical control that you have to be a part of.
So what do you mean in regards to that? Sorry?
At the football incident, that was last week. Do we know how long he was in Melbourne for and how long he's been in Melbourne
So,
for?
as I said earlier, the interviews are going on this morning. So this individual was only presented, his test result came through about 10 o'clock, I think, this morning. The interviews are underway. We'll try to work out with him who he went with, what his journey was, where else he may have been in that period of time. And we'll certainly do an update in the show release later on this afternoon.
Sorry, Brian, when you were saying people buying tickets on behalf of others,
Yeah.
that's for this Euro final event?
That's right, yeah. So particularly for the Crafty Squire is a real focal point for us at the moment. The connection with the Crafty Squire is we have an individual who is at the Trinity Grammar teacher individual who is about Miss Frankie's, infected a number of people there, and was also at Amy Park that night. The night or the morning before that, early Monday morning, he was in the Crafty Squire with some of his friends. We're really keen to understand if there's been any exposure there. We know that particularly at that event, the Crafty Squire, there were some people who bought bulk tickets, handed them out. That's okay, but if they weren't using the QR code system, I need them to be getting hold of their friends and saying, mate, come and get tested today to make sure we know who else is in there.
So sorry, this one individual is quite infectious.
Yep.
So Crafty Squire, Frankie's, and Trinity.
That's right. So we have it in this outbreak to date. We obviously see the usual pattern of household close contacts and transmission within households. We've seen a small number of individuals, 3 at the moment, who've had significant exposure at public exposure sites and then had onward transmission. So this, and through no fault of their own. Again, let me stress, none of us chooses whether we're COVID positive or not. None of us chooses how infectious we are and our behaviour. So there's absolutely no indication that any of our cases have done anything wrong. But what we are seeing is, in particular, three individuals, an individual who's in the aerial apartment, who was at Young and Jackson's, who was at the MCG, who also had a social contact, and his parents, a lot of spread there. We've got an individual who was at the MCG, who was also at Miss Frankie's, who was also at Amy Park, appears to have affected a number of people there. They were also at the Crafty Squire. Brett?
Just on that, given the number of young people that are transmitting this, which is something that other countries have seen, and we've seen epidemiologists say that that's a case for changing, you know, the priority list of vaccines. Is this something you'll be speaking to other chief health officers about, and something that we'll see the AHPPC discuss, given the young people spreading this around in this latest outbreak?
I mean, it's not really a reflection only of being young. Everyone is actually vulnerable both to becoming infected and passing it on. Globally, it's an indication that the older age groups were vaccinated first, and so that remaining cohort, and it depends on the country and how far they've gone through with their vaccination program, as to what age groups are still the most vulnerable. So at the moment in the UK, with the vast majority of the population having received one vaccine and more than half having received the full vaccination schedule, they're at 50,000 cases a day. That is largely driven by those who are not yet vaccinated or who are too young to be vaccinated. That will remain a vulnerability in Australia until we've rolled out the vaccination program more fully, but it is not a question for HPPC, it's for ATAGI with their advice with respect to those age groups. But again, the supply remains the primary constraint, and you could open it up to everyone, but then you'd be preventing other individuals from being able to either finish their course or to even start their Pfizer vaccine.
And Professor Sutton, how concerning is it that the virus has reached Mildura?
Oh, it's always concerning where it spreads anywhere, but of course it is an indication, as the Premier said, that it can move very quickly. It can move anywhere across the state, and these big sporting events in particular, they draw a lot of people from a lot of areas, and so we know that there are literally dozens of primary close contacts across multiple local government areas. They haven't all tested positive, obviously, but they are a risk to regional Victoria in that regard. So, you know, there'll be a lot of work in Mildura at the moment. There's already work in isolating this individual and managing the close contacts through the health system, but there'll need to be a lot of testing done in Mildura. There will need to be a lot of people who check on those exposure sites as that interview is completed today.
Has Mildura had a case before?
I don't believe so.
Was there one in March last year, or am I wrong?
I don't know. Okay. March last year was an eternity ago, wasn't it? Yeah, what's that about?
They certainly haven't had a Delta case.
Yeah, right. Okay. Yeah.
Any other issues of any kind? If
I've got a few, but probably not for now.
If not, thank you. We'll see you tomorrow.
Thank you. Thank you.